Hi, I am Dr. Ajay Marwaha. I am a nephrologist working in Shuriman Super Specialty Hospital, Jalandhar. I am in this field since more than 15 years. Today, I will be discussing regarding which therapy to be chosen between the dialysis as well as a transplant. So once a patient develops a renal failure, which is called a chronic renal failure or chronic kidney diseases, and it reaches a stage once a patient will requiring a renal replacement therapy, then the patient start thinking of which therapy to be opted, whether he has to go for a dialysis or whether he has to go for a transplant. This dilemma remains in the every patient or in the patient's attendant's mind, which therapy is the best between the transplant or between the dialysis. And the workups usually starts up when a patient kidney functions are almost a little bit better, or he hasn't reached a stage of a CKD5, that is an end stage renal disease, when he have to go opt for one of the therapy, or he land up in an emergency when he requires a renal replacement therapy. So I will be discussing about the merits and demerits of each therapy, which therapy is better between a dialysis or between the transplant. So first I will be discussing about what is a dialysis. Dialysis is a procedure in which your toxins, your metabolites, your extra fluid, which the normal kidney takes care, is being taken care by an artificial kidney. Here, the blood comes out of the body, moves through a machine and through an artificial kidney, and it is returned back to the body. Here, the artificial kidney, it is made up of synthetic material, medicated material, which plays a role of your kidney. It takes out all the toxins which are present in the blood, which the normal kidney takes with extra fluid, which is present in the body, and maintain your salt balance, maintain your calcium balance, maintain your hormonal balance is there. So the hemodialysis take care of your kidney part, but what are the side effects of a hemodialysis? One, patient has to go to a dialysis unit at least thrice a week. He has to be on machine for 4 hours thrice a week. And since it is an artificial process during a dialysis, patient's blood pressures can go down or can move up. Patient can develop body cramps, is there vomitings during the dialysis. Even they can affect the heart in terms of any arrhythmias, any electrolyte disturbances. So these are the one which normally disturbances occurs in the body during a hemodialysis. Another form of dialysis is also there, that is called a peritoneal dialysis, which can be done at the home. Here we insert a catheter inside the abdomen. A fluid is there which is put into the abdomen. It stayed there into the abdomen for 4 to 6 hours. And after 6 hours, the fluid is taken out and new fluid is reinserted into the abdomen. This is called a peritoneal dialysis. This patient has to do daily. It can be done by the patient himself also, or it requires an attendant in those patient does not have, or patients are unable to do a dialysis by themselves. But in this case, it has to be done daily. Side effects of this, it can be most common is the infections which can occur in the abdomen, and usually the infections are during the dialysis procedure or doing the procedure being done by the attendant or the patient himself through the hands. Other complications are there in terms of the dialysis is not done appropriately. There is developed a pleural effusion, surgical complications are there. But this therapy, again, a patient opts those who can't go for hemodialysis or those who can't go for a transplant. Now, coming to a kidney transplant. So, what is a transplant? It is basically we input an organ from one of the patient's attendants in terms of his brother, sisters, husband, wife, or mother or father who donates the kidney in him, the blood group is being matched, or there is now a ABO incompatible transplant. Kidney is being inserted into the patient's body, and the body accepts the kidney and start pouring out the urine that the kidneys patient's external patient transplanted kidney take care of the patient's excretory system, like he takes out the extra fluid, maintains the fluid balance, electrolyte balance into the body. What are side effects of the transplant? Side effects means it has the surgical effect that during the surgery anything can happen. Surgical side effects are there. Then patient has to be a long-term immunosuppressants. So since he is on long-term immunosuppressants, so there is risk of getting infections are there. And secondly, another risk is that the body or the does not accept the organ. So the organ get rejected and patient again has back to the dialysis. So otherwise, the benefits are there. Once kidney transplanted is there and it becomes stabilizes, he can go to the work normally. He behaves as a normal life. He lives a normal life. He can have his family further and he works normally. So if we have to select between the which therapy has to be done, whether it is a hemodialysis, peritoneal dialysis, or a transplant, if the options are there, if the donor is available in the family and the matching is there, we should go for a renal transplant. Renal transplant definitely scores number one as compared to the dialysis. So while opting between the dialysis oblique or the transplant, patient or the family has to think earlier which therapy they have to opt. Definitely, transplant scores number one as compared to hemodialysis. Thank you.